Professor Perucca, congratulations on your wonderful award. Does it mean a lot to you to receive it?
Well, it does. I feel really humbled by it. I feel I don't deserve it. I think it's really a recognition not to myself, but to the entire group of people with whom I've been working together over so many years. I think it's a recognition to the teamwork that the ILE has been doing in Europe over the years. This is the way I look at it.
What do you think are the most important challenges for treatment of patients with epilepsy?
Well, when it comes to treatment, the first thing that comes to my mind in terms of challenge is really addressing the treatment gap. I mean, we cannot just hide the fact that the majority of people in the world that live in low-income countries where they have no access to treatment at all, or the treatment could be accessible but not affordable. So this is something that we have all to work on to address and make sure that all people with epilepsy receive at least basic, sufficient, effective treatment. And we never have to forget that 1 year of treatment with less expensive drugs, such as carbamazepine or phenobarbital, is less than $10 per year per patient. So this is a situation that cannot go on for long.
As far as epilepsy research is concerned, what would the top priorities be, in your opinion?
Well, in terms of research, I think I'm biased by my interest, that is pharmacology. But really, again, the big challenge here is that irrespective of income you have, still 1/3 of people cannot respond do not respond to the available drugs. So we desperately need better research into the mechanisms of epilepsy so that we can rationally develop drugs that take care of those people who do not respond to the available treatments.
What, for the future, are the greatest hopes and assets that we have at our disposal to make all of these changes?
Well, at the end of the day, it's people, and we are fortunate in the ILE to have really thousands of young researchers, young physicians who have a unique dedication to the cause. So our discipline is well and alive, research is going, and everyone is committed. So I'm really hopeful that these young people eventually will manage to achieve what we failed over many decades. Well, one of the strengths of the epilepsy world, I'm saying the epilepsy world because this is really what we're talking about, is that we have two organizations. One is the Organization of Professionals, the ILE, the other is the Organization of Patients, the IB, and those two organizations have been working for really many, many years, hand in hand, and speaking with one voice. And this is appreciated at all levels. It's essential when we have to advocate with governments, with constituencies, with authorities. If we speak with one voice, we achieve. And as professionals, we have very, very little power. But if we bring with us the word of the hundreds of thousands of people who have epilepsies and their friends and their families, really we have a strong political base to make sure that the needs of people are addressed for, the needs of research and the needs for better care for people with epilepsy.
And obviously there's a very bright future then because those bonds are very strong.
Bonds that bring together the IBE and ILE are very strong, are going to be very strong for many years to come, and this is really a big strength for us.
Thank you so much.
Thank you.